Evaluation of a case of parotid swelling. Parotid swelling is a common clinical presentation that requires a systematic approach to identify the underlying cause, which can range from benign conditions to malignancies. Below is a detailed approach to the evaluation of a patient with parotid swelling. 1. History taking. Onset and duration. Acute, likely infectious, e.g. bacterial sialadenitis or viral infections like mumps. Chronic may suggest neoplasm, chronic inflammation, or systemic diseases. Pain, painful swelling, infection or obstructive conditions, e.g. sialolithiasis. Painless swelling, neoplasms, benign or malignant chronic diseases. Associated symptoms, fever, infection. Xerostomia, Sjogren's syndrome, or other autoimmune diseases. Facial weakness, possible malignant tumor involving the facial nerve. Dysphagia or weight loss, suggests malignancy. Predisposing factors, recent dehydration or reduced salivary flow, e.g. due to medications, systemic illness. Trauma to the area, history of smoking or alcohol use, risk factors for malignancy. History of radiation exposure to the head and neck. Family and past medical history, family history of autoimmune diseases, previous malignancies. History of recurrent parotid swelling, suggests chronic or recurrent condition. Physical examination, inspection, symmetry, unilateral or bilateral swelling, size and shape of the swelling, skin changes, redness, ulceration, or tethering indicates malignancy. Palpation, location, parotid versus submandibular or sublingual glands, consistency, soft, infections or cysts, firm or hard, neoplasms. Tenderness suggests inflammation or infection. Mobility, fixed masses may suggest malignancy. Regional lymphadenopathy, suggestive of malignancy or systemic disease. Facial nerve examination, weakness or paralysis indicates possible malignancy or nerve involvement. 3. Differential diagnosis. Infectious causes, acute bacterial sialadenitis, Staphylococcus aureus, Streptococcus species. Viral infections, e.g. mumps, Epstein-Barr virus. Tuberculosis or actinomycosis, obstructive causes, sialolithiasis, salivary gland stones, duct strictures. Autoimmune disorders, Sjogren's syndrome, sarcoidosis. Neoplasms, benign, pleomorphic adenoma, Warthin's tumor. Malignant, mucoepidermoid carcinoma, adenoid cystic carcinoma, salivary duct carcinoma. Systemic diseases, HIV-related salivary gland disease, diabetes mellitus, diabetic sialadenosis. Laboratory tests, complete blood count, CBC, infection markers, inflammatory markers, CRP, ESR. Autoimmune panel, ANA, anti-SSA, SSB antibodies for Sjogren's syndrome. Serology, HIV, mumps, IgM, and IgG antibodies. Imaging studies, ultrasound, differentiates solid from cystic lesions, guides fine needle aspiration, FNA biopsy. CT scan MRI, evaluates deeper structures, identifies malignancy and extent of invasion. Sialography, evaluates salivary duct obstruction. PET-CT, for metastatic disease. Biopsy, fine needle aspiration cytology, differentiates between benign and malignant lesions. Core needle biopsy, excisional biopsy, for definitive histopathological diagnosis. 5. Management based on diagnosis. Infectious causes, antibiotics, e.g. amoxicillin clavulinate for bacterial sialadenitis. Supportive care, hydration, analgesics for viral infections. Obstructive causes, sialendoscopy or surgical removal of stones, massage and hydration to enhance ductal flow. Autoimmune disorders, immunosuppressive therapy for Sjogren's syndrome or sarcoidosis, symptomatic treatment, artificial saliva, eye drops. Neoplasms, benign, surgical excision, e.g. superficial parodectomy. Malignant, combination of surgery, radiotherapy, and chemotherapy depending on staging. Systemic diseases, treat the underlying systemic condition, e.g. antiretroviral therapy for HIV. Red flags requiring immediate attention. Rapidly growing mass, facial nerve paralysis, hard, fixed swelling, constitutional symptoms like weight loss, night sweats, and fever. Conclusion: a structured approach, including a thorough history, physical examination, and appropriate investigations, is essential to diagnose and manage parotid swelling. Early identification of malignant conditions or systemic diseases can significantly improve patient outcomes.